Hello friends, I am Dr. Rohit Udaya Prasad, Consultant-ENT Cochlear Implant Surgery at Aster RV Hospital, Bangalore. Today we are going to talk about something which is not commonly diagnosed or people do not present quickly with. This is called as sudden onset hearing loss. Sudden onset hearing loss is a condition which people experience all of a sudden when they have a symptom of complete block feeling in the ear, either one ear or both ears, but more commonly it is only on one side. Most of the people think that this blocked feeling in the ear is either because of some cold or a blocked feeling due to a sequelae after a cold, common cold, but generally it doesn't turn out to be that. They do not present quickly to the clinics or the doctors or the treating physicians, and they end up taking medications on their own. When they do this, they would waste a lot of precious time to treat this condition. What exactly happens in sudden onset hearing loss? Sudden onset hearing loss is more of a sensorineural hearing loss, which is kind of permanent if not treated in the right time. This hearing loss will present either with sudden onset blocked feeling in the ear and complete absence of sound from the ear, along with some roaring sound or a whistling kind of sound, and sometimes with vertigo, which is basically a spinning sensation that the patient can experience. They can be all of them together, or it can be just the hearing loss. If it is just the hearing loss, most of the people do tend to ignore this and may or may not visit their doctors in the required span of time, which is best before 48 hours. The earlier the patient visits the doctor to get this sorted or checked first to know whether it is actually a sudden loss of hearing in the ear, the better it is for the patient. There are a lot of treatment modalities for this issue which is available at Aster RV Hospital. This treatment should be initiated as quickly as possible and not delayed. We see that the patient age group can vary from very young people as well as the geriatric age group. So it's just not focused only on a specific age group, it's got a wide range of people in getting into this problem. Also, we see this problem happens when there is a continuous usage of earphones at loud volumes and the ear can get really stunned. We here can treat these patients with a very good procedure called as intratympanic steroid injection, which will definitely benefit the patient, wherein there are not much of side effects because of the medication being focused locally onto the affected organ rather than taking the medication orally or intravenously. Please do not ignore a sudden loss in hearing, especially when you experience it only on one ear and you were perfectly alright the previous day. You can come over to Aster and get yourself sorted out.